The fight against the novel coronavirus has taken a turn. The World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, says he has been insulted in the midst of fighting the pandemic. He says the attacks are racist, involve death threats, and are an insult to the whole black community. Meanwhile, US President Donald Trump and some of his supporters have accused the World Health Organization of being biased towards China. Trump is threatening to withhold funding for the organization. To discuss these developments, we're joined via Skype by Dr. Kgosi Letlape. He's a health practitioner, a health activist, and he describes himself as an advocate for the health of all citizens. Dr. Letlape, very good morning. Thanks for joining us.
Good morning, and thank you for inviting me.
What do you make of these attacks against Dr. Tedros, which he has described as racist?
I think it's quite sad because the virus does not hold a visa and does not respect boundaries. And the globe has to work collectively to defeat this pandemic. And everyone is needed. And it is quite disappointing when the richest nation and the most powerful man would not want to be part of a joint response from the citizens of the world.
It's not a light threat, though. The US provides a bigger chunk of the WHO budget, and if he puts paid to his threat, that could be problematic.
I think part of the problem is that we've been looking up to the politicians for providing sound leadership. And all of us might have misstarts, and people are trying to cover themselves in terms of whether they came out of the starting blocks in time or not. I think we have to accept that there would be mistakes made. As long as we acknowledge those mistakes and we correct them, we will overcome. I'm encouraged by the fact that the US has been a big spender in assisting globally, not just beyond the WHO. If you look at the HIV epidemic, the PEPFAR fund has contributed billions of dollars to Africa to help us deal with the pandemic. And I hope those financial commitments will continue. I hope the leadership, and I thank Dr. Tedros for the leadership that he's provided and the reconciliatory nature that he has put out there. I think it'll always be a challenge. Being an African and to lead globally comes with its challenges. And I hope all of us continue to understand the challenges that we face as Africans when we participate in global fora.
Some influential people have called on Dr. Tedros to resign. Do you think there are grounds for him to step down?
There's absolutely no grounds for him to step down. If you look at the leadership provided by the WHO now, compared to what happened with the SARS epidemic in 2002, it's incredible. They have learned from the SARS epidemic. They've introduced the international health regulations. They require every member nation to report as soon as possible. People could always argue that the reports could have come sooner, just like it could be argued that the response from nations could have come earlier, that lockdowns could have been done earlier, that the routes that the virus takes, borders could have been closed earlier, or air travel could have been stopped earlier. We should learn to be kind to ourselves as long as we learn from our responses and we become more nimble in the responses going forward. Dr. Tedros will continue to enjoy the support of not just the continent, but most of the world leaders. And I think the WHO should be commended for the leadership that it has provided in dealing with this pandemic.
Dr. Tedros himself has asked global leaders not to politicize this effort to stem the coronavirus. To what degree do some of these anti-WHO calls amount to political point scoring?
I think for me, it goes beyond political point scoring. It's about whether we put wealth first or health first. And you'll see that the challenge in most communities is about the economic impact and how soon people want to go back to business as usual in terms of commercial activity. And I think unless people accept the fact that we should put health first, because there's no point in having an economy with half your population dead. Who's going to enjoy those economic benefits? We need to stay alive now, and that should be the primary priority over economies. And we can always rebuild economies. So it goes beyond the issue of political considerations. It's about whether we want to put money first or people's lives first. As Dr. Tedros spoke, we need to reduce the number of body bags, and that should be the priority for now.
And that staying alive, of course, just to remind our viewers, includes staying at home, social distancing, and improving your hygiene.
Yes, I think people should remember that we should feel fortunate that in South Africa we've had sound political leadership on this matter. Decisions have been made timelessly. The lockdown has its challenges, but has given us tremendous benefits. And we're hoping that we would err on the side of caution rather than on the side of going back too early. And I think people should remember that defeating this virus depends on social issues. It depends on the behavior of society, hygiene, social distancing, and observing the rules of the lockdown. If we do physical distancing and we do hygiene, and we all adopt the attitude of ensuring that people don't share my sneeze, people don't share my cough, and we want not to spread it to others. If we put others first, we will be the major beneficiaries of our own exemplary behavior.
We thank you for your thoughts this morning.
Thank you very much, and thank you for inviting me.
Dr. Kgosi Letlape is a health activist who describes himself as an advocate for health for all citizens.